Hi, everyone. This is Professor Widener. We're going to go over the Chapter 8 lecture, Reproductive Functioning. As we all know, reproductive functioning is critical for continuing the human race, and males and females have very different systems, and those systems develop because of different hormones and varying levels that give us our sexual and reproductive characteristics. The first thing we're going to do is review the male reproductive system. The male reproductive system includes the penis, scrotum, testes, duct system, and accessory glands. There is a diagram on page 332 that gives is a good picture of this, and on page 333 there's a list of the function and the components of the male reproductive system. The male reproductive system produces testosterone that produces the male characteristics of facial hair, increased muscle mass, and a low-pitched voice. In males, the urinary and reproductive systems intersect, so when one is affected, the other one is usually affected as well. Now we're going to talk about the job of the different parts of the reproductive system. The penis's job is to deliver sperm to the female reproductive system during arousal. At birth, there's a foreskin that covers the glans penis. Circumcision is done at birth in some families for hygienic, cultural, or religious reasons. And for the same reason, it's not done for cultural or religious reasons. But usually by the age of 3, the foreskin is fully retractable. It is important to know that if there is foreskin that ever does not retract, it's important to keep an eye on that, because it could become a surgical emergency if there's no flow to that part of the penis. The scrotum is a fibromuscular sac of the skin just below the penis that contains the testes, epididymis, and lower sperm cords. This maintains the proper temperature for the testes to perform spermogenesis, which is the creation of sperm, but sperm are very sensitive to acidic or alkalinic environments and very sensitive to temperature. The testes' job is to produce sperm, testosterone, and androgens. These androgens are also produced by the adrenal gland, which we'll talk a little bit more about in other chapters. They're usually sperm development usually starts around the age of 16 and continues over a lifetime for a man, which is different than for a female. We are born with the ovum that we will have, and then they have a limited supply. The Sertoli cells are in the testes, and they provide nourishment to the developing sperm. It takes about 70 to 80 days for full development, and once the sperm are formed, they go to the epididymis to mature, and they're held there for storage. Male sex and reproductive hormones are controlled by the hypothalamus, pituitary gland, and other feedback mechanisms. If you look on page 334, figure 8.3, there's a good example of that. Neurotransmitters such as norepi stimulate the gonadotropin releasing hormone, which is GnRH, from the hypothalamus. Neurotransmitter serotonin and dopamine inhibit the GnRH. When GnRH, or the gonadotropin releasing hormone, is released, it causes production of LH, which is luteinizing hormone, and FSH, which is follicle stimulating hormone, in the anterior pituitary. That causes stimulation of the testes, causing the following effects. LH stimulates the cells to produce and secrete testosterone, and FSH stimulates the cells to promote spermogenesis. Inhibin, which is also one of the hormones, causes inhibition of FSH, which leads to a reduction in spermogenesis. Testosterone is the other female hormone that breaks down into metabolites of 5-alpha dehydrotestosterone, which is DHT, and estriadiol. Testosterone and DHT inhibit LH secretion from the pituitary glands, while estriadiol inhibits LH, but does so by inhibiting the GnRH from the hypothalamus. Make sure you just check your notes for what those different abbreviations mean, but I think it's easier to say the abbreviations when you're taking notes than to keep spitting the words out. The process of testosterone synthesis occurs in multiple steps. Testosterone with LH stimulation is produced initially by conversion of cholesterol to DHEA and androstenediol, which is ANDROSTENEDIOL. Then the testosterone 5-alpha dereductionase mediates the reduction of testosterone to DHT. Testosterone and its metabolites, DHT and estriadiol, give males their classic sex characteristics that include the facial hair and deep voice. They also are responsible for sexual function, which includes libido, erection, and satisfaction. Testosterone also encourages protein metabolism, which means there's increased muscle mass with decreased fat. Testosterone also regulates metabolism, promotes potassium secretion, and renal sodium reabsorption with increased erythropoiesis. It contributes to acne and male pattern baldness as well. Next, we're going to move on to the duct system of the male reproductive system. The duct system's job is to deliver sperm from the testes to the female reproductive system. The duct system includes the epididymis, vas deferens, spermatic cord, ejaculatory duct, and the urethra. Once the sperm mature and leave the epididymis, they travel to the vas deferens. The vas deferens, the testicular artery, associated nerves, connective tissues, and muscles make up the spermatic cord. The spermatic cord suspends the testes and is the testicular blood supply. Vas deferens widens at the prostate to form the ampulla and form the ejaculatory duct and the seminal vessels. This is where the semen forms, which consists of ejaculatory fluid that includes sugars, proteins, prostaglandins, to nurture and protect the sperm. Semen flows from the ejaculatory duct to the urethra, through the urethra, when propelled from the penis during sexual intercourse. The accessory glands facilitate ejaculation. When a male is sexually stimulated, sperm travels from the epididymis to the vas deferens to the seminal vessels and ejaculatory duct. In the seminal vesicles, prostate liquid decreases the acidity of the ejaculatory fluid and increases sperm motility and prolongs sperm life. Alkaline fluid there also counteracts the acidity of the vaginal secretions. The sperm like a more alkalinic environment than an acidic environment. The Crowher gland secretions secrete more alkaline fluid to offset acidity from the urine transportation. It also aids in lubrication of the penis during intercourse, and it may contain some sperm left over from the prior ejaculation, which is why we always say you can get pregnant from like the pre-ejaculation fluid, because that's could have some sperm left over. Next, we're going to talk about an erection and ejaculation. An erection occurs when stimulated, which results in the parasympathetic nervous impulses in the spinal cord to release nitric oxide. Simultaneously, sympathetic nerve fibers, which cause constriction, are inhibited. The release of the nitric oxide leads to arterial dilatation, filling the blood and tissues, which causes the expansion of the erectile tissue. The penis enlarges and elongates, and the erection is maintained due to the compression and consistency of those veins that prevent outflow of the blood. So this is also interesting because when we give people medicines for ED, we do that to we give that to them so the nitric oxide doesn't break down as fast. And we'll talk about that a little bit, but you'll also see that those medicines are also used for people with pulmonary hypertension because of that. The nitric oxide increases the dilatation of those, in this case, around the blood vessels around the penis, but it also is good for pulmonary artery dilatation to prevent right ventricular heart failure. That's kind of interesting connection there. But during ejaculation, a valve closes off the bladder so no urine is in the urethra, and it kills all the sperm. And ejaculatory fluid is usually 2 to 6 millimeters of fluid, and there's approximately 30 million sperm. After ejaculation, there's decreased blood flow. Everything basically goes in the opposite direction, and the penis again becomes flaccid. Next, we're going to talk about the female reproductive system. The female reproductive organs include the ovaries, fallopian tubes, uterus, vagina, external genitalia, and the mammary glands. Estrogen and progesterone give females their distinct characteristics that include enlarged breasts, wide hips, and a high-pitched voice. The female pelvis can be tricky because, again, it also involves the urinary and the GI system. So if you have a woman with pelvic pain, you have to think through that whole process of, could it be a urinary problem, a GI problem, or a reproductive problem? So that's where your line of questioning is really important, and assessment skills. Because of the close proximity of the three systems, when one system is affected, the other three are usually affected as well. The job of the female reproductive system is to generate eggs, transport the eggs for fertilization, which is ovulation, support fetal development, which is gestation, birth of a fetus, and feeding offspring. Now we're going to go through all the organs in a little bit more detail. For the ovaries, there are 2 on each side of the uterus. It produces hormones, primarily estrogen, progesterone, and inhibin, and these regulate the reproductive function and secondary female characteristics. Ovaries also produce testosterone and other androgens, but the levels are significantly less in women than they are in men. Adrenal cortex production of antigens can be significant in females to produce issues with the adrenal androgens, but they again are not significant as in men. So the ovaries and the adrenal cortex produce testosterone, but they're at very low doses. There are 3 types of estrogen. It's estriadiol, estrone, and esterol. Estriadiol is the most potent and prevalent within until menopause. It's produced within the ovarian follicles with FSH stimulation. The corpus luteum produces progesterone, estrogen, and inhibin under LH stimulation. All estrogen are derived from androgens. The ovaries convert androgens to the 3 different kinds of estrogen. Estrogen is important in reproduction for growth and maturation of the breast, uterus, fallopian tubes, and external genitalia. Estrogen is also important for other non-productive reproductive reasons because it increases LDH cholesterol, it lowers LDL cholesterol, reduces bone destruction, it's an inhibitor of platelet adhesions, it increases collagen and maintenance of the skin. It also offers neuroprotection for the memory and cognition. So you can see why the decrease in estrogen makes women more prone to some things. For example, like they're more prone to heart attacks after menopause because of the reduction in the estrogen. They also can become more forgetful, and we'll talk about menopause in a little bit. Progesterone is mainly secreted from the corpus luteum. It is also secreted by the placenta during pregnancy. Progesterone can be used as a contraceptive because with estrogen, it inhibits and prevents ovulation. Progesterone is a key hormone in pregnancy to maintain the pregnancy because it allows the uterus to thicken, prevents uterine contractions, and prepares the breast for lactation. It protects the fetus from maternal antibodies as well. So again, some women are given progesterone even before they get pregnant to help build the level to maintain their pregnancy. And some women are given progesterone even after they are pregnant to again help maintain that pregnancy. The ovaries develop in utero. Ovaries typically develop in utero by 30 weeks, and initially they have 7 million follicles. By the time a female is born, they have around 20 million follicles, and then by the time they actually get to puberty, they're left with about 400 follicles in place. And remember, that's all they'll have for the rest of their life. All the ova in the ovaries remain in a state of prophase for up to 45 years, which basically means they stay reproducible for up to 45 years. Let's see here, menstruation occurs during the reproductive years. When the follicles mature, when they're exposed to FSH and LH from the pituitary gland. During ovulation, mature follicles rupture, releasing a mature ovum into the fallopian tubes. The ovum travels to the uterus for fertilization. There are multiple pregnancies because sometimes 2 or more eggs will release, and sometimes if you have a identical twins, that will be one ovum that splits into 2. Once the ovum is released, the empty follicle, which is the corpus luteum, secretes progesterone to signal to the endometrium to prepare for fertilization. And there's a nice picture on page 339, figure 811, that shows the menstrual cycle. The fallopian tubes extend from the fundus to the uterus to near the ovaries. They have like little cilia on the end. So once the ovaries release an egg, the fallopian tube uses these little ends to kind of capture the egg and get it into their tubes. The tubes use ciliary and muscular action to move the ovum towards the uterus and to assist the sperm in moving towards the ovum that is still likely in the fallopian tube. If fertilization happens, the same motion moves the zygote or the fertilized egg to the uterus for implementation. Sometimes, I'm sure you've all heard an ectopic pregnancy, but sometimes the egg will plant in the fallopian tubes, and that's a medical emergency because if it bursts open, the mother could bleed to death and the child cannot develop there. The uterus has 3 different layers that all do 3 different jobs. First, we'll talk about the endometrium. That's the inner mucosa lining of the uterus. The hormonal changes in there maintain pregnancy. The placenta, which is there to nourish the fetus. One side attaches to the endometrium and the other side attaches to the fetus to provide the fetus nutrients. If it is not fertilized, this is the part that sheds during menstruation. The myometrium is the middle layer that consists of smooth muscle and a vascular system. During childbirth, it contracts to push the fetus through the vaginal canal. It contracts after birth to constrict blood vessels and control bleeding. So that's actually why even women have some pain during ovulation and during PMS, because those other layers are also, they're doing that motion to help promote fertilization of the eggs. The perimetrium is the outer layer that covers the fundus, but not the cervix. Here, there is a tiny incision for a C-section without going into the peritoneum. This contains the cervical glands that secrete mucus to protect the cervix from infection and protects the sperm from the acidic environment of the vaginal area. It also helps the sperm move through the uterus. We're just going to say a couple more words about the menstrual cycle. Its onset is usually around the time of puberty, typically around the age of 13, although it can be younger or later. It happens throughout a woman's life until estrogen declines with age, which is usually between the ages of 45 to 55, that menses will become less frequent and more erratic, and menopause is defined when menstruation has stopped for 1 year. Decline in estrogen produces lots of different things, but it includes decline in vaginal secretions, behavior changes, often leading to irritability, anxiety, or depression, headaches, insomnia, hot flashes, decrease in collagen, which causes the wrinkles. There's a decrease in bone density, and increased cardiovascular risk because of the changes in the cholesterol. Hormone therapy can be considered for decreasing menopausal symptoms, but you must be careful when using that because there's an increased risk as you get older of stroke, thrombus, or breast cancer. Now we're going to talk a little bit about the vagina. The vagina is a hollow tunnel-like structure located between the bladder and the rectum that extends from the cervix to the external genitalia. It's a muscular structure and usually about 2 to 4 inches long. It serves as the passageway for sperm to travel to the fallopian tubes. It also allows for the discharge of the menstrual fluid, and it also is the birth canal. The vaginal wall is lubricated from the cervical mucosa glands. The vagina has an acidic environment that serves as a protectional function to women against infection. However, it is harmful to sperm, which is why the sperm has all those protective mechanisms to help it fight that acidic environment. The hymen, to some degree, covers the vaginal opening, although it is open a little bit to allow for menstruation, but it is too small to allow for an erect penis because it will tear during their first intercourse. However, it's not a great reliability of virginity because it can tear during physical activity as well. Finally, we're going to talk a little bit about the external genitalia. The mom's pubis is the pad of fat that is over the pubic bone, and females developed hair there over when they hit puberty. The labia major are the two large fatty folds of skin that protect the peritoneum and aid in lubrication of the vagina. The labia minor are two small, firm pieces of skin that fold together, that have a very rich blood supply and nerve supply, and connect at the top to form the clitoris. The clitoris is very sensitive to stimulation and becomes filled with blood during sexual arousal. Stimulation of the clitoris is often required for an orgasm in women. The vestibule refers to that area that contains the urethra and the vaginal opening. The mammary glands are only, men and women have mammary glands, but they're only functional in women. They do not make milk unless they are stimulated to do so. Prolactin is a hormone that is released by the anterior pituitary gland that promotes milk reproduction. During pregnancy, estrogen levels increase, which triggers the production of prolactin secretion. Prolactin secretion matures mammary glands and prepares them for milk production. After childbirth, prolactin initially drops as estrogen returns to normal, but however, the newborn suckling then stimulates the increase in prolactin secretion, which again produces milk to feed the child. So that's a mouthful about the male and female reproductive systems. And now we're going to go through some of the disorders related to the reproductive system. Epididymis is the exposure of the urethral urematus inner lining. It occurs on the dorsal side of the penis. Men who have this are at increased risk for UTI. It often occurs with other urinary defects, which are the bladder extropy, which is part of the bladder, is actually outside of the body. And EEC is a congenital abnormality that affects the penis as well. Men do have an increased risk for UTI, and they also have generally have sexual dissatisfaction. The cause of it is unknown. It is generally the diagnosis is made by physical exam, and should the person want it treated, surgical treatment is the only option. Hypopaditis is when the urethral urematus is on the ventral side of the penis. It's commonly the most common congenital defects. It's caused by the disruption of androgen stimulation during development. And there's also in other parts that are that affect this are environmental exposure and genetic vulnerabilities. Diagnosis is made by physical exam, and again, treatment is surgical. Cryptorchidism is the most common genital urinary tract congenital condition. This is when the testes remain undescended in the abdomen prior to birth. The risk factors for this include a low birth weight, prematurity, multiple births, family history, small for gestational age, and maternal diabetes. To diagnose this is done through a history and physical exam, abdominal ultrasound, MRI. It often includes a hormone level workup and genetic studies. Most commonly, the testes will descend between 6 to 8 months, but if they have not, treatment may include manual manipulation, hormone therapy, or surgical repair. Infertility issues are when a couple has the inability to reproduce. This is defined as infertility is 1 year of actively trying to conceive without any contraceptive use and you're not able to. Male issues related to infertility are related to decreased sperm or sperm abnormalities, hormonal deviations, and physical impediments. This is diagnosed and workup is usually done through a history and physical, sperm analysis, STD testing, just to rule out STDs, hormonal analysis, and pelvic ultrasound. Female issues include ovulation dysfunction, hormone deviations, transport disorders, uterine defects, or pelvic adhesions. This workup is usually consists of a history and physical, ovulation testing, imaging studying, hormone analysis, ultrasound, and again, ruling out STDs. There are lifestyle issues that also lead to infertility, and there's a nice list of those on page 347. Again, in primary care, you may do some basic workup of infertility, but likely these people will be referred to a reproductive specialist. For the treatment of infertility, that's actually what's on page 347. There are different lifestyle modifications you can use. There are immunotherapies. Women can try metformin. Sometimes people can use intrauterine insemination and in vitro fertilization. But just check out the variety of treatments on page 347 in your book. Erectile dysfunction is the inability to consistently attain or maintain a penile erection sufficient to complete sexual intercourse. The risk factors include obesity, smoking, being over the age of 40, sedentary lifestyle, obstructive sleep apnea, infrequent sexual intercourse, and sometimes this is permanent and sometimes it is transient. The dysfunction may come from different processes. They might be physiological, neurological, or vascular. Psychological causes include anxiety, depression, guilt, stress, and relationship issues. Neurologically, this can happen after a stroke if someone is demented, has MS, or they may have low testosterone. As remember, testosterone maintains nitric acid levels, which is required for acquiring and maintaining an erection. There may be vascular issues as well, such as hyperlipidemia, diabetes, or heart disease. Sometimes, please remember this, if you have a young man in their 40s or 50s who comes in complaining of erectile dysfunction and it's a new onset, be sure before you treat them with any ED medications that you work them up for cardiovascular disease, because sometimes that may be their first symptom that they have. Diagnosis is made through history and physical exam. Treatments basically depend on the cause. It may be psychological testing or treatment for their psychological issues. They may consider testosterone replacements, the phosphodiesterase 5 inhibitors, which prevent the breakdown of nitric oxide. Typically, when erectile dysfunction happens suddenly and abruptly, it's a psychological reason, especially but if it happens over time and they still have nocturnal erections, the cause is usually vascular or neurological. Remedies can include herbal remedies. It can include testosterone replacement. However, you have to be careful as that increases the risk of myocardial infarction, CVA, and prostate cancer. You may try one of the medications to help with it. There are other things that you can use, such as a penis pump. There can be penile surgical implants or vascular surgery to improve the blood flow to the penis. Phimosis and paraphimosis are when the foreskin cannot be retracted from the penis glands, and this is what we were talking about earlier. Paraphimosis is when the foreskin is retracted but cannot be returned over the gland's penis. This is phimosis is most common before the ages of 3. There may be pathological phimosis, which is related to poor hygiene, infections, or inflammation. Often these men need a manual reduction or surgery to fix this. If the penis is constricted and the glands become edematous, it is a medical emergency. Treatment for this includes circumcision, topical steroid cream, or foreskin stretching. Priapism is a prolonged painful erection. It is one that lasts over 4 hours and can have ischemic and non-ischemic causes. It occurs when there is a conjunction between the blood, circulatory, and nervous dysfunctions. The diagnosis is, the diagnostic treatment depends on why it happens. Ischemic issues, the most common are that the smooth muscle relaxation is impaired, causing compartment syndrome, or there's nitric acid dysfunction. Risk factors for ischemic priapism include sickle cell disease. When I worked in Philadelphia with the sickle cell team, we had one patient, I'll never forget him, God bless him. Every time he got a sickle cell crisis, his first sign was always that he had priapism, and he had to come to the emergency room, and then he got admitted usually for his sickle cell disease. But other risk factors include leukemia, trauma, tumors, diabetes, neurological disorders, medication side effects, alcohol and illicit drug use, and poisonous venom. It is a urological emergency, and the patient should go directly to the emergency room without being fixed. It can lead to ischemic necrosis of the penis, erectile dysfunction, or infertility. Treatment includes analgesics, sedation, and sometimes they even inject medications directly into the penis to help with it. But if you ever saw this, this would be something you would send them to the emergency room for. A hydrocele is the accumulation of fluid between the tunica vaginalis layers and along the spermatic cord. It is a congenital defect, or it is idiopathic in adult men. You'll see that the scrotum is enlarged. You'll also feel that the scrotum feels hard and is generally painless. The diagnosis is made by history, physical, and ultrasound. Treatment includes things to get the fluid to be reabsorbed, which includes scrotal elevation, sitz baths, and hot and cold application. A spermatocele is a benign sperm-containing cyst. It develops between the testes and the epididymis. It is often painless, small and soft. It is movable, and you can transilluminate it with light. It occurs because of the blockage in the duct system from infection, inflammation, or trauma. And if needed for larger cysts, it is a surgical repair. A varicocele is a dilated vein in the spermatic cord. There are valve issues which causes blood pooling within that vein. It is usually asymptomatic. Sometimes it can be mildly or extensively painful. It really just depends on how big it is. It can cause fertility issues. Treatment is often unnecessary, but you can recommend scrotal support, such as with, like a tight underwear. It can involve surgical repair or an embolectomy, or scrotal therapy, which is where there is an injection of an irritant into that blood vessel and then causes the blood vessel to decrease. Testicular torsion is when there is an abnormal rotation of the testes on the spermatic cord. It can lead to ischemia and necrosis. It most frequently leads to trauma. The primary manifestations are sudden and severe testicular pain. It is often unilateral as well, which I thought was kind of interesting. The physical characteristics you'll see are scrotal swelling, nausea, and vomiting. Diagnosis is done by history and physical and a testicular Doppler ultrasound. And the only treatment is surgery. That's going to end the first portion of this lecture. I'm going to pick up with disorders of the pelvic support next.